Hey everybody, it's Dr. Wood, and today we're covering Chapter 11 about safety and quality assurance. So when we're talking about safety with medications taken by patients, we want to make sure that we are adequately getting a good history from them and making sure we're getting all facets of their medication use into account, because we want to make sure we know this when we're prescribing new medications or changing their current regimen to make sure that we're not going to cause any problems here. So for example, we want to ask questions about if they use illicit drugs or alcohol, if they use any tobacco products, right? We want to make sure we're asking about things like over-the-counter and herbal drug use, which is really important. And then it's important to make sure we're educating on self-medication when also being prescribed prescription medications, because frequently patients don't know when they're duplicating medications. They don't know how interactions work between medications. So that's really important. And that to make sure we're also informing them about OTC medications and how the doses may differ. And so they may not supply an adequate amount of medication for what they need here. A good example of this is like ibuprofen or Motrin over the counter is only 200 milligram tablets, whereas with prescription strength, we'd be giving like 800 milligram tablets potentially. Okay. And then also let them know that OTC medications can also contain more than one active ingredient. If you go and look at like a cough and cold preparation like NyQuil, you can have phenylephrine in it, you can have chlorpheniramine in it, you can have acetaminophen in it, you can have all kinds of different medications. The patient just thinks, I'm taking NyQuil, they don't think anything of it, but they could be taking 3-4 medications potentially. So when we're giving medications, it's important to make sure that we're doing this in the safest way possible. And then to do so, you have to make sure you have good knowledge of the medications, the techniques, and particularly the safety precautions associated with those medications, right? Think about things like dangerous chemotherapy you may be giving to a patient. Think about things that could be given via the wrong route and could be potentially dangerous to the patient. So these are all things we want to make sure we're addressing, and when we're assessing for quality assurance and standards of safety while in places like the hospital or the clinic. So who manages a lot of the regulations around safety of medications? Well, it's OSHA, which is going to be the Occupational Safety and Health Administration. They kind of set up most of the safety parameters there. So for example here, making sure that whenever we're dealing with something that could cause splashing or spraying of body fluids, you should wear protective equipment. There's something called PPE, or personal protective equipment, which can include gloves and gowns and splash shields and things like that for your face. And they really recommend wearing gloves while performing injections, right? That avoid you getting bodily fluid from the patient in contact with you, and making sure that any equipment or supplies that come in contact with bodily fluids get disposed of in the infectious waste containers. Those are usually the ones that have a big biohazard symbol on them. If you're giving a medication and you inject a patient and then have a cotton swab, you wipe off the blood from the injection site from them. That's hazardous, right? That needs to go into an infectious waste container to make sure they don't spread anything to potentially other people or yourself, right? And again, here's an example of what the biohazard symbol looks like. Also, this would be an example of one that could also receive sharps. And really, when I say sharp materials, that is anything that could be that could cause a puncture. That's needle tips. That could be broken glass. It could be really anything that could potentially puncture someone. These are really hard plastic, and it's impossible for things to poke through that. It would be very difficult for that to occur. Other things we can do to help protect ourselves would be to use automatic safety precautions on things like needles and whatnot to prevent us from getting stuck. So here's an example of a safety needle to where you would inject the patient with the medication, and then once you draw it out, you have this little clip here that you push forward, and then this will then cover that tip of that needle there. So at that point, it's impossible to stab yourself with the needle after administration. One thing to note as well is that you never really want to recap needles if you can. Like, the best thing to do is usually put the cap of the needle on the table, and then basically try to scoop it up. That's probably the safest way to use it. Otherwise, if you can avoid that, just go ahead and throw it into the sharps container. It's probably the safest way to get rid of those. A lot of people then try to pick up the cap and try to do it themselves, and then they end up kind of poking themselves, and now you have a contamination, possibly of blood, possibly of medication. Can be kind of a big issue. So it's really important that we're disposing of any kind of appropriate or waste appropriately. Make sure that we have, if people get exposed to a particular substance, that they get the appropriate care. So, for instance, if someone gets exposed to chemotherapy, how do we deal with that spill? How do we do with cleaning up and decontaminating those patients? It's really important that we comply with that, because that can lead to a lot of really big fines potentially for the hospital or for the clinic or wherever. I remember one case where I had a pharmacy technician, who was just kind of on his lunch break, walking around. And one of the things you'll find with kids is they don't like being, cooped up in the hospital. Like, who would be, right? And so we had this one kid who was getting continuous chemotherapy over the course of, say, 72 hours or so, and he's bored of sitting in his room. So he was going around with his IV pole, kind of walking through the hospital, and he was walking by my technician. All of a sudden, the line came out of the patient. It was basically spewing chemotherapy everywhere. The technician had no idea what to do. He's just like, oh boy, I got all this chemo everywhere, and his patient's contaminated with stuff. It was bad news. So we had to make sure we followed the appropriate safety protocols to make sure we protected the patient, anyone that was working with that patient. So like the technician who had witnessed the event, make sure we clean it up so that way no one else gets exposed to potentially dangerous drugs. Now, in terms of quality assurance, it's really important that we make sure that medications are being contained and handled appropriately to make sure they don't degrade or at risk for perhaps being, the wrong concentration, things like that. And so it's important that they're maintained at appropriate temperature. So, for instance, some medications, when they get too hot, they tend to degrade, like insulin. If you have insulin that is left in a hot delivery truck all day long, it can potentially start to degrade, and it would not be useful for your patient. So this is really important because, depending on when medications come in, they may be sitting at the loading dock for the weekend, but it's important to make sure they have relevant controls. So if it's something that needs to be kept refrigerated, it's in a styrofoam container with lots of ice packs to make sure it keeps it at the right temperature. And you make sure that they're sitting in the right container type, and you really want to make sure that the drugs that are delivered are being checked against the packaging slip to make sure everything is there like it should be. Always make sure when you're storing medications on the shelves that you see the label facing forward. You don't want to have a bunch of stuff where you can't tell what it is necessarily. So that's one way to quickly identify medications. And typically we'll organize medications in the pharmacy based off of certain groupings. So for instance, you'll have a section that's just for your oral meds, a section for your ophthalmic meds, a section for your suppositories. And by keeping those distinguished and keeping them separate from each other, it's easier to find medications and not get them mixed up. You always want to check expiration dates to make sure you're not going to give someone an expired med accidentally. And so one way to do this is to always stock the oldest medication in the front. We call that rotating stock. Just like if you were to ever, say, buy a gallon of milk because you were almost out at home, but you bought that gallon of milk early. You took it home. You wouldn't put your new milk in the front and then start drinking out of that because then the old one's going to go bad. Same thing for your medication. You want to make sure you rotate that stock and put the oldest stuff in the front. Make sure keep things away from heat, light, moisture, and air. So keep them in their original containers can be helpful for preventing any issues of contamination. And then make sure to keep any kind of external and internal use medications separate. So keep your ophthalmic medications away from your rectal medications, away from your oral medications. And then obviously if you have any cleaning solutions or any kind of potentially dangerous chemicals, keep them separate and away. As an example, we have some medications that are quite flammable, and so we have a special fire cabinet just for those, and they are kept away from all the other medications which are not flammable. Always make sure you keep the labels intact. If you can't read what the product is, then we have to get rid of it. We can't use it anymore. And always keep it in that original container. And like I mentioned, if it can't tell what it is, then just go ahead and toss it. Now, one thing you want to consider whenever you're giving medications to a patient is to make sure you're looking for any changes that have occurred since maybe the last time you've seen that patient. Especially in pediatrics, they're constantly changing size. They're always getting older. And so that can affect maybe the dose that we're supposed to be giving. Check for new contraindications for medications. Check for allergies. Check for all these things here that may prevent us from making sure we're giving the right drug to the right patient, right? And so always if there's any questions that come up, you always want to double check with the prescriber, right? It doesn't hurt to make another phone call, maybe bothering the person, but it doesn't really matter because if it's patient safety related, then everyone should be able to stop what they're doing and make sure that the appropriate questions are answered there, right? Make sure that there's an appropriate person in the event that an allergic reaction occurs. So make sure you have someone on call that you can reach out to in case something bad happens. And make sure there's a good safe surrounding, right? So especially after like giving pain medications, that can frequently make someone kind of dizzy and woozy. If you give it to them and they have a bunch of like sharp objects around them, that could be bad news because they could actually hurt themselves, okay? Maybe check to see if their family members present and kind of help out, and just maintain a general quiet environment. Tend to find that the louder an environment gets, the more hectic it is, the more likely mistakes occur. Just like in the ER, you walk into any ER, it's going to be loud, it's going to be hectic, and that can lead to errors. So make sure that when we're administering to the patient, give only the ordered medication. Definitely know which drug is being given. And when we're trying to figure out, well, how much volume do I need to draw for this particular dose of a drug? Always make sure you're going to a nice quiet area. Usually you have a medication room you can go into, do your calculations, and have someone recheck you, right? It doesn't ever hurt to have a double check. Always make sure to wash your hands. You don't want to handle the medications directly. Usually, you either want to use syringes, or if you're, putting things into a pill cup potentially, whatever the case may be. And then when you go to the patient to actually administer, make sure you identify them, not just based off of their name, but also like a date of birth or a medical record number or something like that. You want to use multiple identifiers to make sure that you don't actually have the wrong patient. Just like if there's a John Smith in room 1 and there's John Smith in room 5, you want to make sure you get the right John Smith to give that medication to. And always ask about allergies. You never want to miss one of those. All right, some other things to think about. If you ever have unused medications, while we do try to recycle where we can, medications will not be one of those. So just go ahead and dispose of it, get rid of it completely. And then when you're documenting any administrations, make sure to give the medication first before you actually document it. I've had nurses who have accidentally gone through and said, oh yeah, I gave this dose, and then the patient wouldn't take it, right? And then their documentation is now incorrect. Watch them for any adverse reactions. Document anything that might actually occur. And then if there's any errors, you want to report that to the provider, physician, whoever immediately. And make sure that whenever you're figuring out your doses, make sure to consult handbooks to make sure that the dose you're giving is actually appropriate based off the indication, the patient, etc. So one of the things we'll talk about in terms of patient safety when giving medications is the 7 rights. And you see the 7 of them here, and we'll talk about them in more detail coming up. But basically, these are ways that we try to ensure that we're giving everything correctly to the patient to avoid any potential errors. We get the good therapeutic effect we're looking for while preventing any sort of issues. So first off, you want to make sure you get the right patient. And while this may sound pretty easy and straightforward, it may be more difficult than you think about, right? So always make sure you check with the patient, not just by their name, but also by some sort of other identifier, like their date of birth or their medical record number or something like that. Again, if there's any confusion, always stop to double check. Because again, some patients may not be able to tell you what their name is, right? If they're intubated and sedated, if they're a child, things like that. And so you have to be careful because like in a busy ER, you may have 3 beds with the last name Smith, you have 2 beds with the last name Rodriguez, and you have 4 beds with the last name Jones. And so because of that, it's very easy to get patients confused. I'll tell you one example of in the neonatal neonatal intensive care unit in ICU. We'll frequently have twins that'll come in and they don't have names picked out yet, so they'll just be listed as baby A and baby B, and they have the same last name. I mean, talk about confusing, right? How do you make sure you're giving the right drug to the right patient? Well, that's where our barcode scanning comes into play to make sure we get the right person. So when you're getting the right drug, make sure it's the exact right concentration, it's the right spelling of the ordered drug, all those things, right volume of drug, because some of these drugs may have similar sounding names. Some of them may look very similar. So you have to be careful. Just because a syringe comes in with a pink medication doesn't mean that it's the same pink medication that you're thinking it is. Maybe it's something else. Think about the names of the drugs being similar, like hydroxyzine and hydralazine. Very easy to mix up there. And then always check your expiration dates to make sure you're not giving something that is already expired. In terms of the dose, you want to know that the dose is within the acceptable dose range for the patient there, based on their age, based on their weight, etc. And to do that, you have to have a working knowledge of the medication. And so depending on where you work, there'll be a different, sort of plethora of medications you'll have to know, but you'll get used to that when you're working in that field for a while. Always double check calculations. It'll take a few extra seconds, but it'll be worth it to catch an error potentially. And make sure you use the proper device to obtain the best measurement you can. So for instance, using a insulin syringe calibrated to units to measure insulin out. Using a TB syringe if you're using very small volumes, say less than 1 ml. Those are the things you want to make sure you're doing correctly. In terms of timing can be really important. You don't want to give medications too soon or too long apart because that can have issues in terms of either getting toxic levels if they're given too soon, getting subtherapeutic levels if they're too far apart, and it can really affect how well the patient reacts to that drug. So that is something you want to be wary of. Make sure the route matches up with the medication order, and then make sure the patient doesn't have any injuries that may prevent them from using the desired route. So for instance, if they have a lot of oral sores in their mouth because they're on chemotherapy, maybe they can't take something orally. Or in some cases, actually giving the wrong route may be fatal. We have a drug called vincristine, which is a type of drug used to treat leukemias. And if you give it intrathecally, meaning into the spinal cord, you can kill the patient, right? But you're thinking, well, how would you accidentally give something in the spinal cord, right? How would you accidentally give it intrathecally? It can happen because very frequently those patients are getting IV vincristine the same time they're getting intrathecal medications of another variety. And so if that were to get mixed up, it has killed people in the past. So again, the right route can be really important. The right technique here is important to make sure you're using aseptic technique, making sure you're keeping everything sterile and not introducing bacteria and germs and things like that to where the patient may be exposed to it, and maybe if their immune system's not very good, perhaps they'll develop an infection. That can be a really big problem here. And make sure you're using appropriate, sites. So if certain muscles are not good for intramuscular use, that's not appropriate. And make sure the delivery technique is actually important here. Again, things like, respiratory medications being delivered appropriately can affect how well they work. And then documentation is always really important here. Any patient assessments you need to note need to be marked off. Any dates and times, you want to make sure we know that, so that way we have good accounting for when medications were administered, so we know when the next dose is due potentially. And then oftentimes things like lot numbers, expiration dates, and manufacturer is documented for immunizations. Just in case there's ever a bad batch, we can go back and check those out. Again, patient reactions, education, everything needs to be documented in the chart, and this should be done after drug administration in case something came up. Maybe they spit it up, they threw it up, something like that. So again, looking at this, you can see that every piece of the pie has to be accounted for here to make sure that it's all done appropriately to avoid any sort of adverse reactions with your patients. So why are there some sources for medication errors? Well, just like anything, we are prone to error. And so any medication given incorrectly could be potentially tragic in terms of adverse effects, or it could be really costly depending on the case, right? So anytime you have a confusing order you're not sure about, always ask a question and always be aware of possible drug interactions that can actually pop up as a result of the meds that you're giving. If an error is made, first thing you got to do is check the patient, right? Assess them to see if they're having any issues with it, notify the provider, and then proceed as needed. Sometimes we'll have medications we'll have to administer because of an error. Sometimes you may need to stop medications because of the error, and then make sure you document everything. And then very frequently, people make errors not because they're intentionally neglectful or because they have malice in their heart. Oftentimes it's more of a system issue, and so this is why it's really important to kind of go back and look at the process to see what led to the error, to see if you can do something about it in the next time. So that's it for this section. If you have any questions, let me know, and I'll talk to you soon. Thanks a lot.